have learned that the body has its ability to heal itself. With PRP, you come in, we draw your blood, we spin it down, we concentrate their platelets so they're concentrated much greater than they normally would be in the system, anywhere from 2 to 8 times. And then we introduce their own platelets into the area of injury.
So first we're going to do is image your tendon. And in fact, on this image you can see the bone, but you also have some calcium deposits in the tendon itself. Pretty significant partial tear right there. So I would imagine your pain is really up in here. Does that hurt up there?
Yeah.
And that's exactly where it is on the pictures.
So this injection, where does the blood go? Like where did it go?
I'm going right into that tear and breaking up some of the calcium while we're there.
We inject the area.
This is another view. We went a little higher up into that hole, and we're filling it with your platelets right now.
And those platelets in turn release your own growth factors that you have. And those growth factors are what you use to heal tissue. And we have basically rebooted your healing computer. So it becomes a beautiful alternative for treatments for various ailments that we think appropriate. And nobody rejects their own blood. We definitely have demonstrated for those who have chronic tendonitis or tendinosis, abnormality in the tendon like tennis elbow or golfer's elbow, rotator cuff, Achilles, definitely can help that patient have improved function, have less pain, can do more, and in a good percentage of them we actually can see a tendon that has healed from a tear. Arthritis, it also seems to have, we're looking at the data right now, it's all new, it seems to have a pretty significant effect, especially if we get to the arthritis earlier. We haven't been able to demonstrate new cartilage yet, but we've been able to demonstrate no progression of their arthritis at a year, and symptomatically they're doing much better. You need some relative rest for the first 2 weeks.
Right now your platelets are already releasing their growth factors. The process has already begun. You're starting to heal yourself. And they release their growth factors over about a 10-day span. What are my expectations? In 2 weeks, I would expect you to look no different. Between 2 and 6 weeks is when you really gain a tremendous amount on this. Having said that, a lot of patients within the first 2 weeks are already better.
You're tapping into the individual's healing system, which in pure sense is great. It's not an anti-inflammatory, it's not a narcotic, you're using your own system to heal yourself. Now in a pure sense,